So you all know that Nigeria is the largest country in sub-Saharan Africa. It's about 175,000 persons, and they have million, thank you. And they have had a small outbreak which came from Liberia, and he'll probably talk a little bit about that. And they've so far contained it, and it's an interesting story. I hope we can keep him on so he can tell you how they've contained it. There's a lot of lessons in this. I want to thank everybody who made this happen, Charlie, the initiative, and Kevin Shulman, and of course, Muhammad Pat, our faculty member, who was the previous minister of health. And I'm hoping we can keep him long enough so you can hear the story. The latest numbers I saw were 19 cases, 12 survivors, and 7 deaths. But in a country of this size, if it got, into as we talked on Monday night, it got into urban areas, and it could really be a lot more. And so far, they've done a fantastic job, and I think hopefully he will tell us the story. And then if you have questions, we're happy to try to get them answered. So we're just waiting for him to come on the line, right?
Yeah. So, Daniel, we're ready to go when you are.
Yeah, we're ready to go.
Okay.
Okay, very good, Dr. Shuaib. Welcome. You have in the room here about 60 persons. I'm sorry you can't see us, but we look forward to hearing your story. We're very pleased to have you here today. I'm Dr. Merson. I run the Global Health Institute, and you have people from all over Duke who are here this week in what we're calling Ebola Week. We've had a number of presentations and discussions, but everyone is keen to hear your story, so welcome.
Thank you very much. I'm pleasure to be here. My name is Faisal, and I'm the Extension Manager of the National Ebola Emergency Operations Center. By way of outline, what was the characterization of the outbreak, how do we figure out what what's the related procedures, what the current status of the outbreak, and then the next step. After that, wrap up with the second message. I know you had engagement around the weather visit, so we can go over these sites because about what Ebola is. It is a virus that belongs to the family of cell-like viruses. The outbreak in Nigeria has actually been traced to one of the 5 strains, the direct strain of Ebola virus. Most of them isolated in Nigeria. As you all aware, Ebola virus is accounts for up to 90% clinical therapy. You are familiar with how it is transmitted, contact with secretion, and one of the things that we see in Nigeria is this outbreak is the fact that there is a high risk of Ebola infection, and I'll get a person later. I'm not sure how many of you are aware where Nigeria is the west coast of Africa. That's the Nigeria right there in Cape. It is a large country of over 130 million people. It is ranked as the 26th globally. One of the unique attributes of Nigeria is the fact that it is an oil-producing country. The way you think about resources in Africa, which is already associated with, low levels of development, on the other hand, is ranked as the 8th largest exporter of petroleum. And it's particularly important because one of the years where we had an outbreak is actually Lagos State. For example, in Lagos State, which is an oil-rich city. So, of course, there are institutions for economic angle that comes to having an outbreak of Ebola virus. I think I explained in the past the outbreak of Ebola in Nigeria was in Nigeria. We traveled from Nigeria there. This is showing the map of West Africa. Monrovia, the capital city of Africa, is right here. And we traveled by air and landed in Lagos. We were very quick by the time we traveled. We were admitted to the private facility in Lagos State, here. And after the evaluation and the facility, the diagnosis of the Ebola virus called DDT was confirmed on July 23rd of this year. Immediately after this confirmation, the government of Nigeria declared a public health emergency. Unfortunately, this individual died on the 25th of July, 2 days after this that was confirmed. Again, one way public officers, unfortunately, we had Australian session. As is today, we had headquarters coming down the beginning. And the second aspect of the outbreak in Nigeria is the fact that although we were able to rapidly identify the contact and detect them, one of the contacts actually dated the scene for a couple of days. We were deliberate on the need to enter the country, particularly to apply to some data where we get to report it for hazard at the end of the hazard. As you would expect, there's a lot of attention around the potential effects we had a wide scale of TB, they talked about oil companies wanting to wake up and give Nigeria into time, something that never happened. This outbreak ended up being one of the most difficult in terms of having to show different contacts. We ended up using some practical activities from that in this early stage. This is the last previously, we have an southern part of Nigeria previously here, and this is where this individual and then came to Rapid and Lagos State. He was looking for 3 days for visiting from Chicago, and then came back after that 4 days to Lagos, and then we established contact with him. This slide just shows the epidemic curve to show the progress of the situation of the disease up to the last stage that was concept on the 12th of September here. Moving on, so in terms of what the country is only doing to contain outbreak and then also the explorative efforts that we do. Immediately, the state of Hong the Ministry of Health, declared the public health emergency and set up the Ebola Emergency Operations Center. Working together with the Lagos State government and the partnering with us to use CDC, National Frontiers, and NSF, and the Red Cross, and UNC was set up in Lagos, where operations is usually 24 hours. It's usually an assembly of experts in public health, which is the one thing, analyzing data, interpreting data, and then taking action based on agreed strategies and plans. When we look at the organizational structure of the Ebola Emergency Operations Center, we see that we have here is the Ministry of Health, who provides general guidance and the outlook form for the day-to-day run coordination of the entity, and those we talk about the person for the trade manager. The trade manager provides the verification and coordination of the EOT and is accountable for ensuring that all resources are brought together to contain EDT in the country and this work for making all the resources from the partners. So one of the hallmarks of the EOT is a situation where you have resources, human and material and financial resources that the different partner agencies are pulled together under the EOT concept. So we don't have, what seems to be the case where you have partner agencies working in silos in this situation under one EOT advocate for helping action towards one target to stop the outbreak of the disease. When we sort of unpack the building block of the EOT, there are four key areas of work that we find where accountability, the state management team is responsible for strict implementation of the standard operation procedure for implementation, for shipping and sharing programs. The state management group is also responsible for decontaminating homes for these resources were extracted. This will provide the draft solution and that provide counseling to all patients of EBD and also their contacts and family members. The other building block of EOT is knowledge forever unit. This is a very big unit. It is responsible for analyzing and acting the pain of transmission and ensuring that every stage of transmission is stopped. It is also responsible for linking all the contacts. The EOT is the case the contact between policy and list all the possible contacts. They also manage the Ebola headline. So if there are no more people that have information around the Ebola virus disease, we have a record for people sort of triage involved. The other moving block is the port of entry. Because the previous is actually going to the airport, we're going to be screening at the street, at the airport, the seaport, and the land portion. We have individuals, we have staff of staff who actually do screening of all the people that are either arriving or departing the point. One of the key responsibilities of the port of entry is to also ensure that if there is any case of EBD that comes into the country, they have the capacity to administer the patient at the right way to the Ebola treatment center. Another critical building block of the social mobilization and communication unit. One of the key areas that is able to implement is international communication. When the outbreak of Ebola happens, there is a lot of apprehension, with a lot of time, and among the community members, the digital declaration is how people have to how they talk to traditional leaders, social opinions, leaders, sort of, give them the correct messages around Ebola virus. And then there was sort of work that was done social media, using Facebook, Twitter, and then the Ebola website. So, what are the engagement that use program that sort of created the story of resolving outbreak? One of the key innovations was a real-time recording of the temperature of the contract. So for all contracts that users on a daily basis. We have forecasting systems, ending, and also going to the houses that people. This is the federal on mobile phone, and immediately we have that as a people, there's a real-time alert that goes to the command center of the POC that tells the state team that we have a contact that has a fever and state management team is responsible for if are going to this location where that is patient and where that is contact is, but we also have geo-coordinates of where the contacts are, and these contacts are found that if engaged to the very confined processing of BCD, then they got linked to the Ebola virus treatment center. The rest of analysis is what kind of technology in the Ebola virus outbreak. What is also very important as an outbreak response to develop indicators that assess performance of the outbreak response. For instance, we have all the four areas of work in terms of people, the ethics, surveillance dashboard, the state standard utilization. We have indicators to describe the performance of the work. This is an example of social utilization indicator. So on 12 and sometimes for some indications, where we could extract the proportion of the social utilization, the proportion of households described by mobilized. So we have a project of 10 households per day, and this indicator is output has all track these activities project. Now, in terms of the current status of the outbreak response in Nigeria and where the next steps are, during the course of the outbreak, was over 800 in Lagos and Lagos State. Again, one thing that we done as an outbreak response is to ask the necessary wise because we know that meeting a single case or a single contact can lead to the transmission of Ebola virus. And once that has been totally control of the outbreak, and the good news is that following up more than 800 contacts in one day, and some of them developed and some of them were discharged. Today, we do not have any cases that are processed of CDC in Nigeria. Because earlier, the scientists confirmed cases over the course of the outbreak. They were 10 driving and 7 deaths. So, what works for the Nigeria group? You know that in the West African region, it has a topic of EDD that is in Guinea, Nigeria, and Nigeria. What is left is that left around West Africa and Western world. We know that we have to be very quickly a contact developed symptoms, we move in and depart with them. In Nigeria, one of the things that we realize is sort of effect from how we can handle the outbreak is the fact that we have a unity, the central coordinating mechanism where all partners, all expertise and state decisions around the priority set required to combat the outbreak using an incident command system where all resources are managed through a unitary command system. one that is strong and probably not present in all parts of the healthcare investment where it has continued to implemented and accountability framework. When the team agrees that they are specific activities that is being conducted with specific timelines, every team member is held accountable, in terms of delivery on the specific timeline and delivery on the specific target. And then the other thing that we have, and here is the fact that we have team research in approach more these environmental factors who are able to deploy everything that to change this outbreak. What was important? One thing that is not is that it is not enough to feel that we provided absolutely very sufficiently so that the contact the probably would have been situations where we have complete transmission of the virus. We cannot access the disease for example. But yes, we have a situation where a contact can be testing from Chicago, and we have to provide hospital measures for instance in developing the society so that if contact is detected, it's possible for it to take a fight to. And of course, when we arrive, for example, at the state of the outbreak, one thing that we found was that in spite of the environment that had already been established, the training, the pre-position of the site, the level of preparedness, we have taken after higher these. So only we get really complicated. So the two measures, and we can sort of guiding us outside, although they are reporting the human and material resources, people are not having time to exercise, they are not able to exercise with preparation for an eventual outbreak. So what are the lesson plans? Again, I cannot emphasize, the fact that it's more sensitive for animals, it still has to be regular contact. The health facility has to be designated as an isolation facility, and the management protection necessary to keep up for Ebola virus operation. One thing that can fully block us and is the time misinformation. So a situation where people feel that there are other remedies that can be applied to cases of ED. So instead of presenting the health facility or reaching out to health workers, the need for treating themselves, which only delays contact treatment is very important. What we do is ask out the license to ensure that all contacts were identified and immediately develop symptoms. We were able to isolated. Another thing is the process of coordinator and it's not really easy to come up with the concept. What are the next steps? So we now have a situation where we have a few people that don't have that process, and we pull it off all our contacts. So the job is not done yet. So what we're doing already process the next few weeks to handle the capacity of the national and state government team and identifying systems, networks, and personnel that we can handle as we can do. So we can find all of these lessons to take the part of this process in the first place so that we can, find the response if we do have another outbreak. Then of course we are taking a system of real-time relation theory and to that good to take the organization. Then the other thing we can do is 40 as you know, although we never have over 800 people to follow up and to package the numbers of contact traces. We think it's really important to the state and the national team continue to provide oversight over epidemic preparedness. Moving on, we're also maintaining a focus on key resource preservation. We still have an outbreak with West African region. So the activities like cleaning at the port of entry and the airport, the land portion, the people that continue. We asking for relevance to the health authorities and community. There are community informers. That people that there are people that develop symptoms that are supposed to be coronavirus. We also taking precautions in other health states. So we have developed multi-spray trainers from the other states, Nigeria, country states, and the outbreak has happened in two states. So for the remaining agriculture, particularly agriculture, we are eliminating guidelines and the efforts that we have done for these two states, and then continue to monitor the level of preparedness for them. So the level of summary just to talk about the second what is going not often discussed, the fact that the first case of EBD in Nigeria was reported by Nigeria, who got an epidemic in Lagos. The federal government and Ebola virus, EAC, and then a lot of observers feel that this is one of the key reasons why we were successful. Of course, only the overall finish was provided by the Authority of Health, who is the public health service of the Republic of Nigeria. And then this management approach that ensure that all research were harnessed for this outbreak. Although we know that the CT have handle on the outbreak, we recognize that there is a few outbreak in Nigeria, in Syria, Guinea, and equally a persistent threat to the spread of EBD to Nigeria. So for us, the reflecting our past, we know that the job is not over. So we may return to state ministry of health. We will continue to provide oversight to the state and monitor the academic encouragement, especially for the states that have not witnessed an outbreak. Thank you very much.
Thank you. Dr. Shuaib, Dr. Mike Merson here. I first want to congratulate you on the outstanding work that you and your team have done. It sounds like you have, for now, forestalled a major problem, but you're right. You're keeping your surveillance and your team together, and because we don't know what's ahead. But again, I really want to congratulate you. I'm sure you've had many sleepless nights and really have worked hard. So more than anything else, all of us here want you to know that. Will you take a few questions? Will you take a few questions? Okay. So let me say, okay, for those of you who may be listening on WebEx, you're welcome to send a question on the chat box. If you're listening to this outside the room, those of you in the room, I prefer you raise your hand, not send us a chat. And I probably will repeat your question unless you say it really loud, because this is basically our microphone here. So we have 15 minutes. Charlie, you want to start? Anyone want to start?
They've been so successful in Nigeria. It's a great story. Are they in touch with other states along the coast and Liberia especially? Are they helping out?
The question is, are you in touch with other countries in the region?
Yeah, absolutely. There's a regional cooperation that's taking place. We're sharing standard operating procedures, our guidelines within country. As a matter of fact, even as I speak, there's a plan to set up emergency operation centers modeled after the Nigeria experience in Nigeria and Syria. So what we have learned from this outbreak is being replicated in this country. As a matter of fact, they talk around the possibility of human resources from Nigeria being deployed for outbreak in this country.
Okay. Other questions? Yes.
So my question is, first of all, fantastic talk. Considering how one case has such a strong potential in terms of spreading the disease and how demand generation is such an important issue in terms of awareness, what else? I saw you in the slide that you showed that government is doing a lot to increase the demand. But how much awareness regarding Ebola, how it's spread, is prevalent, do you think, in Nigeria?
So the question is, well, you have a very large population, very spread out, and how are you able to get people aware? How well has your various approaches to communications worked? You said you had a very large social media campaign, for example. What is the awareness level now?
Yeah, one thing that we've seen over the course of the outbreak is an increase in the level of awareness. Because people were really afraid, people reached out for information. There was a lot of discussion going on in the social media around the outbreak. The media, different social media, were very active throughout this process. And we also had our team engaging with people in the community through their traditional leaders, through their leaders to pull we had them deal with stories. We had our community leaders talking to their community members. We also had discussions going on in social media. People we have put out questions around the outbreak. So over the course of several weeks, people voluntarily reached out for information around EVD, and we saw the ramping up of information around the outbreak.
So traditional healers obviously played a role in the community. That's interesting. They were very strong traditional healers in the country. Other questions? Must have other questions. Let me ask, while others are thinking, how much has your polio experience helped you? All the work you've done on polio, was that useful to you in dealing with Ebola?
Well, absolutely. One of the reasons why I was deployed to lead the Ebola Emergency Operations Center is really because of the experience I have with running the national polio EHC at very significant times. So what we did was just to replicate the system that can be successful in addressing our challenges with polio. So we set up things that we felt were able to prioritize the activities that are required to overcome the outbreak. So yes, short answer to your question is my experience with polio actually put me in good stead for this Ebola system and Ebola.
Interesting. Yes.
Yeah, could we get a copy of the briefing forwarded, as long as with his email as well? Because that would be very helpful.
Well, there's wondering whether you'd be willing to share your slide set with us.
Absolutely.
Very good. Well, someone will be in touch with you about that. Sure. Other questions? So I read this morning in the press that they're looking for places to test the new Ebola vaccine, and at least one thing I read said maybe you would be willing to test it. Is there any truth in that?
Yes, there are conversations that are going on around test devices in Nigeria.
So you might be willing to test one of the new vaccines. Is that true?
That is absolutely the conversation that's being held. I am not aware that that has been finalized. But yes, conversations around testing the vaccine are being held.
So he's not aware, but he's heard about it. He probably read the same news story I read. There's a bunch of vaccines. There's a British vaccine, there's a Canadian vaccine, and there's an American vaccine. I don't know which one. I guess the American vaccine, they're looking for a place, if it shows to be safe in phase 1 trials in the States. I mentioned this on Monday in my talk there, that they're hoping to find a place to field test it right away in Africa. Nigeria has been mentioned as one of the places. Other questions, comments?
Yeah, absolutely.
Yes, go ahead.
Do you foresee all the time and resources that are kind of being put into Ebola right now having an effect on other diseases?
Very good question. So the question is, you've obviously put a lot of your resources. You've had to shift resources to deal with this crisis. And obviously, so far, you've done a great job, but you obviously, there's expenses involved. What has that done to your other health care services? Are other people able to get care for the routine problems and that you see every day? What impact has this had on your ability to take care of all your other health problems? Very good question.
Yeah, absolutely. The case in point really is the concern that Ebola virus disease outbreak was also going to divert attention from the goal of certain transmission of coronavirus in Nigeria. We are at the point, the kind of situation where we feel that there's a few more rounds of campaign, a polling campaign, and then the first transmission of coronavirus in Nigeria. That, low level, low numbers of vaccine viruses. And when the outbreak started, my deployment and the deployment of other human resources for the polio program, that's concerned. The one thing that we observed is that yes, it has expensive, yes, there has been a huge deployment of resources, but because we were able to contain the outbreak within a relatively short time, the impact we feel might not be as bad as potentially to that day. We are not going to study being done to evaluate what the use of opportunities were, what the opportunity costs were, and so that we can study what we can get, evidence around how much we got from this outbreak.
Okay, interesting. Yes.
How quickly was he able to mobilize workers to track all 300 contacts, and could they rely on current employees, or did they have to press upon new
Question
people?
is, how quickly, there must have been some fear, so how quickly were you able to mobilize healthcare workers? Did you have to find new workers? Did you shift workers away from other positions? Did you have some of the healthcare workers, I'm sure you've read, I know that some of the healthcare workers in other countries have died, quite a few, and you lost a physician. I'm sure that was very sad. I'm just wondering how that went, and it's an issue that many of your neighboring countries are struggling with.
Yeah, that's right. In the beginning, we had the pilot of getting clinicians that will manage the disease patient. management. Clearly, because there's a lot of apprehension around the fact that some other people have significant died. But after proper training on how to manage this patient, people they have medical officers and nurses that came out in groups to come and help this process. I don't know how much you're aware of the fact that we tend to have periodic outbreaks of Lassa fever, another virus with fever. So when we had the Ebola virus without the nurses and some of the doctors that had previously managed Lassa fever patients were actually deployed in the early days to support case management of ED.
So what you heard is that they've had experience with another similar virus, Lassa fever, and that was made it a little easier for them to mobilize their healthcare workers. They had less fear among the healthcare workers because they have dealt with Lassa, which it's actually an interesting point. I'm not sure if that's the case in Liberia. Yeah, go ahead.
Did they use the military in this crisis, and if so, how?
Did you use your Nigeria? You have quite an impressive military. Did you use your military at all?
Yes, we did. Yes, we did use the military, the public health officers, and the military were definitely part of this reform. They had environmental health officers, they had doctors and nurses, who were deployed to support the case management, the contact entry, and also the transmission utilization. Yes, they were an important people in this aspect of that. Given the kind of commitment and courage that they showed, I feel excited when I heard the team that President Obama was deploying 3,000 military to support the work in that area. I think we have a huge resource that can come very good.
What was the most important role that your military played?
Some of them were part of the case management team. They were talking about the case management team, but we also had some of them that were involved with contact tracing.
Tracing.
So mostly case management, contact tracing, and then a few of them were also helpful in organizing screening at the border.
So they help some of the management, but also contact tracing, which would make sense, I think. One last question, Randy.
So some of the economies in the other countries have been decimated by the reductions in travel, reductions in trade. Have there been economic impacts in Nigeria as well?
The question is, we know that in Liberia, certainly Sierra Leone and Guinea, the impact of the outbreak there on the economy is profound. Do you imagine any economic impact on your outbreak, so far? Do you imagine this will have any negative impact, tourism, trade, or any other issues that could impact on the economy?
Yeah, absolutely. We can indicate that in the response team, following the duration of the public health emergency, that who are going to come to Nigeria. There was a lot of apprehension around transmitting the disease, so that would have affected farmers. Again, I don't know that people have been analyzing the see what kind of impact this that has on the economy. The conclusion is that it didn't last, for as long as the corporation will have it was not contained. So there's no doubt about the fact that stuff has an economic impact on the country, especially given the fact that one of the only teams was affected, the carpet. There was a lot of apprehension from the oil industry on the impact on trade and commerce in the carpet. But we think that will be something very early on.
It's interesting. So the oil is on the harbor, so people don't want to dock their boats and ships. So, well, let me say to you again, Dr. Shuaib, there's about 60, 70 people here, many of them students. Who knows, one of them may be in your shoes someday. And I'm sure they're very inspired by what you've done and what you've achieved. And we certainly wish you all the success and hope that you have no more cases, and would welcome your visiting us next time you're in the States and presenting in person the full story of your experience. Thanks again. Let's all give him a hand. Okay, thank you. We can cut off now. Thanks. So I just want to say this is quite a story. I know you couldn't hear it perfectly, but the slides were very good, and I will just say that this is a very positive development in Nigeria. It's basically, what I can tell, it's basically over. From what I can tell in terms of the transmission endemic. The obvious challenge now is, as you saw on the map, they're not far from Liberia, and Nigerians are big travelers, and there's a lot of trade, and particularly in the oil industry. And so I think the real challenge now for them is how they're going to manage importation. But I will say, as a big country, they're very well organized. I don't know how many of you know, how much all of you know about what they've done for polio. But I think I asked that question deliberately because their effort to eradicate polio is a big priority. And I'm sure that network, which has been heavily funded by the Gates Foundation and others, I heard Melinda Gates yesterday on NBC News, very proud of what the Gates Foundation had done in supporting polio there, and how her reports from her field staff was how much they had switched all that effort over to Ebola, which I found quite interesting. So, I mean, I think sometimes you never know the investment you make in an infrastructure works in ways you could never imagine. So it's an interesting, very positive story, and nice to have this session about that. We have one more, right, Charlie? One more event?